Diabetes, like other cardiometabolic diseases such as heart disease, stroke, and obesity, are quietly rising in Ghana, with more young people now being diagnosed. Now, health data from the World Health Organization, it shows that thousands of cases are recorded each year as changing lifestyles and limited early detection continue to drive the numbers. Experts are warning that without urgent action, the country could face a growing health burden in the years ahead.
Felix received news that would change his life. What seemed like a normal day quickly became a turning point.
I attended a conference at Kofrodua. At the conference, I realized that every minute I was thirsty. So I started drinking water. By the time, within an hour, I'd finished about 24 bottles of water. So after the conference, I came back to Accra, spoke to my cousin who was a medical doctor at Akimoda. In fact, at that day, they checked my sugar and they said it was 21. I didn't even understand. So they told me that everybody's sugar has a range. So that is why I got to know that I was diabetic.
At 40, it was not easy to accept, but he had to adjust his entire lifestyle. Over time, the condition has not only affected his health, but also his finances.
Once I was diagnosed, then it means I had to manage my life. My food intake, the time I eat, the drugs that they have given me, I need to take them on conscious efforts. Currently, I'm on insulin, and depending on the liters that you take a day, sometimes it can't even take you to 3 weeks. So in a month, if you are not careful, you can buy 2. And there are some other drugs too, which are not captured by the NHIS.
Felix's story is becoming increasingly common. Cardiometabolic diseases such as diabetes, heart disease, stroke, and obesity are on the rise globally. The World Health Organization estimates that about 24 million adults in Africa are living with diabetes. The WHO warns that this number could rise to 55 million by 2045. Here in Ghana, the Ghana Health Service says between 2.6 and 9% of the population is affected, with around 200,000 cases recorded at health facilities annually. Samuel Seidu is a professor of primary care diabetes and cardiometabolic medicine.
The rise of cardiometabolic conditions is attributed to the changing lifestyle. As becoming more affluent, people are getting more sedentary, doing less and less physical activity, and especially in the young adults. The young adults, those under the age of 40, and these ones are actually the ones who hold the health economy for us. So if any of them gets diabetes, hypertension, or heart attack or kidney disease, the whole system crashes.
Experts say that while treatment is important, prevention is just as critical. For Professor Alfred Yorson of the University of Ghana College of Health Sciences, lifestyle choices play a major role.
Most of these are preventable through lifestyle changes. Being active, watching your dietary habits, having enough and adequate sleep and rest, avoiding risks such as alcohol, smoking, and others.
Dr. Norbert Kipo is the policy advisor to the administrator at the Ghana Medical Trust Fund.
Once it goes beyond the NHIS and there's very little to no coverage, then the Ghana Medical Trust Fund comes in due to the catastrophic cost involved in the management of chronic disease.
But Dr. Alfred Doku maintains that stronger health systems are needed.
Management of these diseases are a bit isolated. So if you go within to the health system, you go to a diabetes clinic, you go to hypertension, cardiovascular disease clinic, you go to see another doctor for different things. But what is important also for the patient's comfort, is to have an integrated care. So this patient doesn't have to come to the hospital to see 3 different doctors.
Felix's message is clear. People, especially men, need to take their health seriously.
It is something that if you are not careful, you might not even know that you have it. My little investigation shows that men, I think we are not very, we don't take our health issues serious like the women. So I encourage all men and boys growing up to at least visit the hospital once in a while to check their status.
With more young people now being diagnosed, the need for early action and effective intervention is becoming increasingly urgent. A healthy lifestyle is therefore recommended for all.